Alright, so now we'll be talking about consumer health informatics. So consumer health informatics is really informatics from the patient's point of view. So what we're trying to do with the patient is increase their education and their health literacy. Especially for those with chronic diseases, they need to know the main disease management techniques for that specific disease. So with consumer health informatics, the biggest thing is we're trying to use technology in order to kind of empower and engage the consumer to want to manage their own health. Okay, so like I said, we'll be using technology to really get to this goal. So some new technologies that we'll be using in consumer health informatics will be mobile health applications, patient portals, and also fitness trackers. Okay, so first off with the mobile applications. So you can get a mobile health application that is specific to your chronic disease. And what it does is it'll first educate you about your disease and have certain daily things for you to fill out in order to kind of track your progress, see if you're going in the right direction, and also help you out along the way. So one study that I found was a study for diabetes patients. So it was a 3-month study where they gave one group use of the mobile application, the other group did not use any technology. So the group that was using the app, they were inputting daily lifestyle factors, getting medication reminders, and also tracking things for diabetes, such as blood glucose levels. And what was found that after the 3-month study, there was a average decrease of 1.95% of hemoglobin A1C levels. Okay, and the group that did not use technology saw a decrease in only 0.79%. Okay, so it's a big difference. So that's just an example of how a mobile health app can impact a chronic disease such as diabetes. So next up for patient portals. So patient portal is a app that you can use, a web application that links directly to a hospital's or a health organization's EHR to really just communicate and get access to previous records. So an example I found was in asthma patients. Okay, so this was done at a pediatrician's office. So it was younger kids. They were average about 8 years old. So the parents were involved in this one with the use of the patient portal. Okay, so they had half of the group using the patient portal. The other half was not using the patient portal. The patient portal was used for tracking symptoms, medication, side effects, increased communication with the pediatrician. Okay, small things like that. And then after the 6-month study, it was actually shown that patients who used the patient portal with asthma, they saw less asthma flare-ups, and actually they attended school more often. Okay, so they missed, the population who was not using the patient portal missed school. So that's just a big thing, especially for children who's managing a disease. You want them to get to school in order to get the proper education, and if they don't have the right disease management techniques, they're going to be held back. Okay, so this is a great example of how a patient portal can make an impact in even a children's life. Next up, we'll just talk about the fitness trackers quick. So fitness trackers are great, especially the one group that I can think of would really be the diabetes patients who need to get active and moving. It's great to keep to stay engaged in your health. I have a Fitbit, so from personal point of view, it just gives you little things like a little daily goal to get to. You want to try to get to 10,000 steps. Also, if you have friends with the Fitbit, you can do little challenges, so it really kind of keeps you motivated. Okay, so those are just some new technologies that are used in consumer health informatics in order to impact how we manage our chronic diseases.